So today our topic is adenosine triphosphate among all biomolecule. So it is a high energy compound or high energy biomolecules. So it is also known as ATP. Okay. So when ATP is hydrolyzed, okay, it releases a lot of energy. So that ATP was converted into ADP. That is a adenosine diphosphate. Okay. If same ADP is written or it can reconverted into ATP means what it can require the energy. Okay, so when it is hydrolysis, ATP into ADP, it releases energy. So that energy is required for the regulations of the various biochemical reactions and as well as signaling transductions. That is the communication between the different organs or organelles of the cell. So within the cell or cytoplasm of the cells, so organelles are communicated by a communications or signaling transaction. So that is the role of the ATP. And so then ADP, it can reverse or it can reconvert into ATP. So where it can require the energy. Okay, so that's why. So adenosine triphosphate, it is a high rich energy compound as compared to the ADP. And among all the biomolecule, so ATP is a considered as the high energy or rich compound. Okay, so regarding already you learned in the yesterday regarding the ATP. So ATP is a also known as adenosine triphosphate. It is the main energy currency of the each and every cells or cells functions. So they are mainly depending upon the ATP. Even our body function so was depending upon the source of energy. So source of energy when decreases, then automatically we are suffering from the fatigue, that is unable to concentrate on the daily activities or in the work. Okay, and ATP productions from the cell or in the body, it is mainly depending upon the conditions of the CNS or conditions of the your brain. If you are under the anxiety or fear or depression, then on that time the brain activity was decreases. Okay, so as the brain activity decreases, so there is no control on the cell, there is no control on the organ. So due to that, so those cells do not involved in the productions of the ATP by glycolysis or TCA or electrochemical transactions or transmission. So due to there is no control, so they are fail. So that's why the energy was not produced or ATP is not produced. Then only we are suffering from the fatigue. So that's why you always free from the depression. So any person without problems, so they do not present or survive. Okay, always the problems are came in our life, but you do not depend on the problem. You can find out the solutions. Okay, you give task to brain. So problem is there, what can I do? Okay, you find the solution. So then any answer is occurs in your brain or develop in your brain, then according to that you can manage your life always. Okay, and always you free from the anxiety or fear. Okay, because it is a more common in the working professionals, especially in the females. So anxiety, fear is a more problem. You don't worry. Okay, you should be strengthen yourself. Okay, nothing will do with anything for you without your permission. So like that, you can develop. Then your energy level in the body is always high. Okay, because of by calming or control CNS, and as well as so energy level is always rich in our body in those people. So they regularly early morning they were wake up, so before 6 o'clock or 7 o'clock. So those people throughout the day, so they are energetics, because in the morning session only the detoxification process is occurs in our body. So where if you involved in the exercise or meditations or yoga, then all the toxic substance they are removed from the cell or removed from the body. Okay, so due to that their cells is the highly energetics, they are fresh. So they are involved in the generations of ATP. Then your whole life you should be the energetics. Otherwise in early morning still you are in the sleep means, so there is no detoxing process is occurs during the sleep or drowsiness. So due to that all toxic substance, so they are present in our body. So due to that whole day we are suffering from the confusions, we are suffering from the fatigue. So that's why you wake up early morning, do some exercise at least 20 minutes, because If you're doing exercise only 5 minutes, after 5 minutes you're taking the rest, means it is not also workable, because less exercise is responsible for development of anaerobic reactions in our body. If you're doing 20-minute exercise, so then it is enhance the aerobic reactions in our body, so due to that there is no that much of the toxicity was produces. Okay, so always directly do not go for the that is cardiac exercise. Before that you can take the warm up. Okay, slight warm up you can take. After that you can go for the vigorous exercise, because if you are not taken warm up, means so that was responsible to cause of the bronchial asthma or bronchospasm. So before starting the vigorous exercise you can go for the warm up for 5 minutes. So after 5 minutes you should be relaxed. Then after relaxing you can go for the running or speed walking or many other cardiac exercise. Okay, so that those exercise is keep healthy from the various allergic reactions, and as well as throughout the day you should be under rest. Or if exercise is not possible for you, means you can generate the ATP through yoga or as well as the meditations. So dear students, so here the ATP is made up of the adenosine. So adenosine is the main molecule. Whatever the ATP's functions are there, physiological effects are there, so those are depending upon the adenines. Okay, that's adenosine. It is made up of the adenine and as well as the ribose sugar, and there is a 3 phosphate groups, that is the phosphate group 1 and phosphate group 2 and as well as the phosphate group 3. Okay, so that's why it is known as the adenosine triphosphate, and adenosine is made up of the adenine and the ribose. If ATP, if it is loses one molecule of phosphate, then it can releases the energy. Okay, so after losing of one phosphate group from the ATP, it becomes the adenosine diphosphate. It means the hydrolysis of the phosphate group in any compound or any biomolecule, so that was releases the energy in the form of the ATP. Here also, due to hydrolysis or loss of phosphate group from the adenosine triphosphate, it was releases the ATP. If same ADP, if it is gain the one phosphate group or additions of one phosphate group, then it require energy. Instead of it release energy itself, it can require energy for formations of the adenosine triphosphate. Okay, so then the adenosine diphosphate, it can loses another molecule of phosphate, then it becomes the adenosine monophosphate, that is also known as the AMP. Okay, so what also it can release the energy. So like that, ATP, ADP, AMP, these all are energy containing compounds or molecule. Among three, the rich one considered as the ATP, that is adenosine triphosphate. Okay, so here the ATP is also the end product of the various process that was occurs in our body, like photophosphorylations in the plant and as well as phosphorylations reactions in our human body. So where the energy can be processed, as well as in the plant during the cellular respirations and fermentations, certain energy was produced in the form of the ATP. Even in the human beings, so due to phosphorylations or breakdown of larger particles or breakdowns of biomolecules like polysaccharide or glucose or certain amino acids or fats or lipids, so were also the ATP was produced similarly in the plant. So this ATP, it is a water soluble. Okay, and whatever the energy was produced mainly, so that ATP is utilized for the signal transduction. Okay, that is nothing but transmissions of the information from one organelle to the another organelle or from one cell to the another cell. Okay, so that signal transduction, it is required. Okay, for all the cells will work in the unique directions. Okay, otherwise if the signal transduction is decreases, means so there is no communication between the cell, and cells are individually work. Some cells, so they are involved in the positive, show the positive effect, and some cells they can show the negative effect because they do not have any directions due to lack of signal transaction. So that signal transaction is mainly depending upon the energy or ATP as well as the calcium. Okay, so calcium is also required for signal transductions. So that calcium turnover is mainly depending upon the formations of AMP from ADP. In certain reaction, the ADP was converted into cyclic AMP. Okay, cyclic adenosine monophosphate. So this cyclic AMP is involved in the regulations in our body. Okay, so it is responsible for the release of the calcium and accumulations of the calcium. So that release the calcium is required for the signal transactions. Okay, signal means informations. The informations is in the form of current or electric, so that can carries by the positive ions like a calcium. Okay, calcium can be transmitted from one place to the another place. It is having the certain informations energy, and next organelles or next cell it can pick up the calciums or that signals, then according to that only their work. So that's why the whatever the body reactions are there or biochemical reactions are there in our body or in the human beings, so they are mainly depending upon the ATP. If you are daily fatigued or in your body the energy level is less, means all the biochemical reactions should be the abnormal. So that's why, so those people they are under the stress, under the depression, under the anxiety or fear, so those people only, so they are suffering from the various kind of the disorders. Okay, stress is also present in the farmer also, but the farmers are hard workers. Okay, so their energy level is high always, so they're consuming healthy food without any pesticide. But we people, we also consuming the food, we also instead of food we consuming the fruits also as compared to farmer, still in our body, so there is no that much of the ATP level. So that's why we are easily the suffering from the chronic disorder as compared to the farmer, because we are always live in the stressful life. What happens when I am not reaching to the correct time to college, or what my friends are thinking, today I am not wearing the good clothes. Okay, so like that we are thinking, or some students are thinking, I do not have any Apple mobiles, but my all classmates are having the Apple mobile, and what they are thinking about us. Okay, you don't worry that. Okay, because if you concentrate on that, means so energy level in our body was decreases, so that was responsible for to decrease the signal transactions or communications between the organs, then the cells do not involved in the removal of the toxic substance from the body. Definitely that candidate was suffering from the diabetes mellitus. Definitely, so that candidate was suffering from the cancer. Definitely, so that candidate was suffering from the asthma also, because of lack of detoxification process in our body. So that detoxification process is mainly depending upon the energy level in the cell. If that level was decreased, means the detoxification process is not occurs, so then only we are suffering from the various kind of the disorders. For you as a family students, you always enhance the energy level in your patients. Okay, or you are in the family, because so they having the positive energy in their body, means easily they are overcome. For example, so in the city some doctors are there, so they do not touch the patients, only they ask the symptoms and they find out the signs, and according to that they directly write the prescriptions without that much counseling to the patients. But some doctors are there in city or as well as the rural area, so they can talk to the patient freely. Okay, not about the only disease, so they also talk that patient with family or family problems or matters. So for the patients all their family problems, so they can tell to the doctors or they tell to the counselor like you, the found students, then that candidate was free from the problems. Okay, if he free from the problem is immediately the energy level was increases in the patients. So when they can out of the hospitals or clinic, they feel like this doctor is good or this candidate was good, because all the problems are solved by his parents, but that candidate do not give any medicine still, but only the counseling patterns, so that was reflect to enhance the energy level. So that's why here my request to all you pharmacy students, you always counsel the patient or talk with the that is the patients in freely manners, whatever they are there. You don't go for the standard rules, freely you can talk with as a friend, as a family member, then they all their problems they can inform to you. So those problem only, so they are helpful for to give the therapy. For example, if the patient was suffering from the high blood pressure or hypertension, okay, you can, the patient is came, you can monitoring the blood sugar, that is the blood pressure level, then you can got the blood pressure is more than some. Then you can confirm you are suffering from high BP, then these medication you can take, medicine A for morning, medicine B for morning and evening, and you can, if any emergency, you can take the medicine C. But is not the patient was not satisfied because you do not find out the risk factor why the blood pressure was increases. If you're counseling, you can ask to them, okay, so what is your family, that is family members are there, how many children are there, and what they are doing, and how your relations with your parent, that is husbands or wife, how the relations with your children. So they inform to you, okay, so my children are not care for me, okay, I am spending my whole life to my children, they grow up, now they become the officer, but they do not care for us, okay, we are living here, my children they are living in the America. So that is the loneliness is a risk factor for hypertension, not any organs abnormalities. Okay, then where you can guide for them, you don't worry, you are rich, you are making the ideals, you are giving your effort to your children's. Okay, so that's you are the ideal, you don't care for your children, you live alone happily. Okay, or if you have any problem, you consider me as your daughter and son, so then they think someone is for me, so then any problem they will discuss with you. So have so problem, then smartly, okay, you can answer to them. So then those risk factors like loneliness, so they are decreases by only patient counselings, there is no medications. Okay, so that is the part of the form D candidate. Okay, always counsel the patient on the ground, go to the ground level, and always you counseling the patient with good communications. And here the communication means it is not that you can always speak in the English. So what language is understand by the patient, on that language you can speak or counsel. If you don't know that language, you go for the other local language, so that was easily understand, or it can create the communication between you and your patient. So that's why the language for the communication is the most important. Okay, otherwise it can create the barriers. Okay, so that's why you always, my request is always enhance the positive energy level in the patients. Okay, so next one is the, so regarding the generations of ATP. Okay, the ATP in our body was generated by glycolysis, that is the breakdown of glucose into pyruvate. So where about 2 ATP molecules was generated, then as well as same pyruvate they can enter in the Krebs cycle, so where the 34 molecule was produced, where the pyruvate can convert to acetyl CoA and carbon dioxide, and later on, so that acetyl CoA it can transported into the respiratory chain of the inner mitochondrial membrane. So due to transportations of acetyl CoA, certain electron can be transported. So due to transportations of electron, certain ATP was generated. So these all ATP, so they are the required for the to regulations of signal transductions and as well as to regulate the biochemical reactions. So regarding the functions of ATP, so ATP is helpful for active transport, for transportations of the water soluble substance or polar substances like sodium, calcium, potassium, and as well as it is helpful for synthesis of new chemical bond or new peptide bond. For example, amino acid join together with the help of peptide, it can form the particular protein like insulin. Okay, so that peptide bond is formed in the presence of only ATP. Without energy, so that peptide bond do not forms, and lack of peptide bond, the desired protein that required for the growth of our body, development of body, that cannot be possible. So that's why the protein synthesis in our body is also depending upon the ATP, and as well as the biosynthesis of cholesterol. The cholesterol is the main component of plasma membrane. Okay, the strength of the cell or integrity of the cell is mainly depending upon the plasma membranes, and plasma membrane integrity or strength is depending upon the component of cholesterol, and that cholesterol is also synthesis is also depending upon the availability of the ATP. So as ATP source is decreases, then the cholesterol is not synthesized, then easily the person was suffering from the allergic reactions or many other disorders due to lack of the steroidal hormone in our body. Okay, the steroidal hormone in our body like glucocorticoids, cortisol, or many others are there, so they can protect our body from the any environmental changes or internal changes. So those synthesis is depending upon the cholesterol. So that's why cholesterol is important. If it is high, then only we are suffering from the various serious disorder. Up to normal, it should be required for our body for synthesis of the steroidal hormone, and steroidal hormone they can protect the our organ, acts as the insulator during the stress. Okay, during the stress there is a chance of the breakage of the blood vessels or breakage of the organs or breakage of the brain, but that cannot be possible due to presence of the steroidal hormones like a cortisol. Okay, so that's why the protection to your delicate organ during the stress or depression, that is also depending upon the ATP. Okay, and it is also supply the energy for various mechanical work like a muscle contractions. Okay, so others are, it is required for muscle contraction, allosteric modifier in the proteins, then biosynthetic reactions as well as conductions of nerve. Okay, that is the transmissions of message from nucleus to the axon and from axon to the organ, that was mainly depending upon the ATP. So as the ATP, for example, in the morning, if I ask any question in the class, means immediately your tongue will tell the answer. But the same condition, if I am asking in the evening time any questions, so where the answer is cannot easily came on your tongue because of lack of ATP in the evening time, you are suffering from the fatigue. But your brain generated answer, this is the answer, you know, but immediately you cannot be recalled. So that is depending upon the nerve conduction, and nerve conduction is mainly depending upon the ability and of the ATP, and ATP is also required for the active transport and coupling reactions and precursors for the cyclic AMP, and cyclic AMP is also signaling molecule. Okay, it is required for to create the communications. So regarding the role of ATP in intracellular signaling, so if any ligand hormones, see they do not cross the plasma membranes or any drugs. Okay, because we need to control or regulate the cellular responses inside the cytoplasma, but certain hormones are there, that is adrenaline, noradrenalines, insulins, and certain other growth factors are there, so they do not cross the plasma membrane, but so they are regulate the cellular response inside the cytoplasma through a ATP intracellular signaling. Okay, so plasma membrane, so they are having the made up of certain receptors. Okay, so with the help of integral protein or peripheral protein, and these ligand is nothing but molecule, maybe protein, maybe drug or any hormones. Okay, so they bind on particular type of receptors, then so they are activate the that is a membrane enzyme like adenyl cyclase. Okay, so here ligand like adenylin, it bind here and it can activate the adenyl cyclase, and adenyl cyclase is the enzyme. It is responsible for conversions of ATP into cyclic AMP, and further the cyclic AMP is responsible for activations of the protein kinase A, that is also written as the PKA. So this PKA, it is one of the signaling molecule. If it is activated, means all the cell response is occurs, that is the breakdown of glycogen or synthesis of glycogen or accumulations of calcium or release of calcium. So whatever the cellular response are there, or synthesis of proteins or decrease the glucose level, so these all are depending upon the activations of signaling molecules like protein kinase A. So those hormones, so they do not cross the plasma membrane, but so they regulate the all cellular response inside the cytoplasma through a ATP, because so they bind on the receptor and activate the enzyme adenyl cyclase, then that enzyme can convert ATP into cyclic AMP, and cyclic AMP is responsible for activations of the protein kinase, because the cyclic AMP is responsible for accumulations of calcium. Okay, due to accumulations of calcium or release of calcium in the cytoplasma, so this enzyme is activated, then this enzyme activate the, that is the protein molecules, so those are involved in the signaling inactive into active. So the signaling molecule regarding the proteins, so they are present in the inactive form. So due to presence activations of protein kinase A, so those all molecule become the active, then so they are involved in the regulations of the cellular response. So like that, ATP, it can create the signal transductions by activating the kinase molecules or kinase signaling molecule through a adenyl cyclase. Okay, and same ATP, it can also trigger the intracellular messengers and releases include like hormones. Here by it bind here and it can release the various hormones or various enzymes, lipid mediators, neurotransmitter, nitric oxide, growth factor, and even it is responsible to cause of the formations of reactive oxygen species. So these are the various biomolecules. So their release is mainly depending upon the signaling transduction, so that was generated or created by ATP. So that's why ATP is considered as the signaling molecule or involved in the signal transductions. So next one is the regarding certain clinical evidence they already reported recently regarding ATP. So ATP is also play important role into control the pain. Okay, if you have the body pain means, so energy level in your body can increase by taking the glucon D. Okay, you're taking the certain sweets, so that can supply the glucose. Glucose is metabolized, then ATP was produced. Then automatically your pain can be relieved. So that can prove by the certain scientist. Because so this ATP consists of adenosine, so that adenosine can bind on the adenosine 1 receptor and it can initiate the signaling cascade. So due to that, the inflammations can be relieved. Or due to that, it can decrease the allodynia hyperalgesia. Okay, due to entry of adenosine or administrations of adenosine. Adenosine is the component of ATP and ATP is the produced from the glycolysis or breakdown of the glucose. Okay, if you are having the body pain continuously throughout the year, throughout the month, throughout the day, then you can increase your ATP level through by consuming the glucose pure. Okay, so that glucose can metabolize, then it can produce ATP. So that ATP, it bind on the adenosine 1 receptor, then it can initiate the signaling cascade. So due to that, it can decrease the inflammation and as well as allodynia and hyperalgesia. These are the form of the pain. So due to heat or due to cold, certain pain is occurs. So those are known as allodynia and hyperalgesia. Okay, so those are also modified by the ATP. So that's why certain scientists they are prove ATP is also have the role in the pain control. And also the ATP is also having the role in the anesthesia. Okay, if you administer ATP source along with our adenosine along with anesthetic drug means where it can decrease the need of dose of anesthetic agent. Anesthetic agent nothing but it can cause the loss of conscious. So that loss of conscious was helpful for to do the surgical operations. Okay, where we give the anesthesia, but certain anesthetic drugs are there, they produce the toxicity due to dose. But the research scientists they are doing, they decrease the need of the anesthetic dose by administered along with the ATP or adenosine. So that adenosine, it acts on the once again adenosine receptor, it can decrease the neuropathic pain, ischemic pain, hyperalgesia, and also it can decrease the need of the opioid drug after surgery. So after surgery our organ having the pain, okay, full pain, so where the doctor they administer the opioid. So due to consuming use of more opioid, it can develop the dependence and as well as it can more deeper CNS. But by administration of the adenosine or by enhancing the ATP source in the patient, so that was decreases the need of the dose of the opioid after the surgery. And as well as the ATP is also having the role in the cardiology or surgery. So this ATP is mainly helpful for to decrease or to treat the pulmonary hypertension related to the congestions in the lungs. Due to that the hypertension occurs because during surgery, so the bronchial secretion is increases. So due to increase the bronchial secretion, the patient was suffering from the pulmonary hypertension. But administrations of ATP or ADP, it can reverse the pulmonary hypertension by showing the vasodilatory effects once again by acting on the A1 adenosine receptors. So these are the clinical evidence published in the various research article regarding the role of the ATP in the various conditions. Okay, so next one is the cyclic AMP. So it is also known as the cyclic adenosine monophosphate or 3,5 cyclic adenosine monophosphate. It is the second messenger. First messenger is enzymes, first messenger, hormones. So those hormones and enzymes, so they regulate the intracellular response by activating another messenger. So that's why the cyclic AMP is known as the second messenger. It is involved in the various biological process. And cyclic AMP is mainly derived from the ATP. Okay, ATP is hydrolyzed in the presence of the adenyl cyclase, that can convert it into cyclic AMP. So this cyclic AMP is involved in the activations of the protein kinase, that is converted into cyclic AMP, that is ATP in the presence of adenyl cyclase, it can convert to cyclic AMP. So that cyclic AMP, it can involved in the signaling through by activation of the protein kinase. So then all the cellular responses occurs. And same cyclic AMP, it can metabolize in the presence of the phosphodiesterase enzyme, that is PDE, then it converted into 5-AMP. Okay, but only the cyclic AMP, it is having the role regarding the signal transductions by enhancing the or activating the that is protein kinase enzymes. So regarding the cyclic AMP pathway, so if you administered any drugs or hormones, so they do not cross the plasma membrane but they act on the receptor, then so they are activated this enzyme, that is the adenyl cyclase A. Then adenyl cyclase A is responsible to convert ATP into cyclic AMP, and the cyclic AMP, it can activate the inactive protein kinase into active protein kinase A. Then that active protein kinase it causes the phosphorylations of the target proteins, then all the cellular response can be occurs. And same cyclic AMP, it can metabolize into 5-AMP in the presence of the phosphodiesterase enzyme. So regarding the role of or functions of cyclic AMP play important role in to reduce the inflammation, and as well as it is involved in the intracellular signal transductions, because certain hormones like glucagon, adrenaline or many other, they do not cross the cell membrane. Through they can modify the organ function, cell function through a cyclic AMP. And also cyclic AMP involved in the activations of protein kinase that is required for the signalings. Then as well as it can regulate the calcium level through a operating the calcium channels or release the calcium from the sarcoplasmic reticulums. And other functions like it is also involved in the to cause the bronchodilation. It means the ATP or cyclic AMP, it can avoid the bronchospasm. If in your body if the ATP level is decreasing, means then we are suffering from the asthma also. And as well as the cyclic AMP, it can accelerate the fat burning. Okay, so that's why if having the worry about the weight gain, means you increase your ATP level in your body, okay, through exercise, aerobic exercise, yoga or any other meditation, then ATP is increases, so that ATP is converted to cyclic AMP, then cyclic AMP enhance the fat burning, then our whatever the obesity is there, weight is there, so that can be loses. So that's why you always increase your ATP level. Then cyclic AMP, it also prevents the platelet aggregation, that is the clumping of the platelets in the particular place inside the blood vessel. This was responsible to cause of the atherosclerosis or blockage of the blood vessels. For healthy purpose, platelet aggregation is required for the wound healing, but it occurs inside the blood, means so that was responsible for the blockage of the blood vessel, then that condition was known as atherosclerosis. But cyclic AMP is also prevent the aggregations. Okay, so already you know, so those people are under stress, those people only, so they are suffering from the blockage of blood vessels, and those are healthy, so they are having the energetics, they are having the more ATP, they are free from the blood vessels blockage, because so they having more cyclic AMP, so that cyclic AMP, it can prevent the platelet aggregations. And as well as the cyclic AMP, it can show the positive inotropic action in the heart. It means it can enhance the force of contractions of the cardiac muscle that was required for to create the pressure on the blood. So that pressure is helpful for movement of the blood from one place to the another place, and as well as removal of the waste material. Okay, if any substances, so they enhance the force of contraction or contractions property of the cardiac muscle, mean so those drugs are known as the positive inotropic drug. And here the cyclic AMP, it will be having the positive inotropic effect on the heart, so due to that it can enhance the performance of heart. If it is more excess, then only we are suffering from the tachycardia or hypertension. And as well as cyclic AMP, It is helpful for decrease the intraocular pressure inside the eye. So due to certain stress, our eye become the redness or irritables because of to increase the intraocular pressure. But the cyclic AMP, it is also decrease the intraocular pressure. Due to that, it is helpful for the treatment of the glaucoma, and it acts as the anti-glaucoma. And also cyclic AMP is helpful for to reduce the blood pressure by stabilizing the blood vessels or by stabilizing the brain. Okay, or by neurosis through the brain, it can control the blood pressure. So that's why you should be maintain the positive energy level in your body. Okay, always you should be think positive. That thinking of positive in your brain, that can create the energy level in your body. Then you are free from the various kind of the disorder by through a enhancing the cyclic AMP and as well as the ATP.